really sort of what got me interested in the idea of children's neighbourhoods. And of course, the local authority is part of the picture. And as you guys know from having been around and visiting various sort of third sector organisations, it's quite a cluttered field in Scotland. We've got the local authority, we've got numerous third sector, we've got the private sector. And what we were trying to do with the idea of children's neighbourhoods was to take a place-based approach that brought the strengths and the assets within each of those different organisations and sectors together, so that the totality of the impact was greater than the sum of the parts. Okay, so that's a really helpful way of introducing. I'll try and keep it brief because you've been talked a lot, and I think the way that we've gone quite deliberately is from the big historical picture into sort of a more micro forensic. But I'm going to try and move back out again and talk more about sort of a programme and an approach. I'm going to do it really quickly, right? So I'm sorry I didn't speak quickly because I wasn't going to talk much longer. But essentially what I want to do is give you an overview of what we did, and then draw out the lessons from some of the insights of the practical challenges and complexity of implementation, and then think about how this approach and way of thinking can go forward in the future. And the context is really important. And when you look at the data, and this is dated now, but this is from an area not far from here, actually, just the other side of Button, the main road. And what you see is a community, a neighbourhood, lots of nice greenery around it, and lots of facilities. And although Glasgow is very challenging as a city, you see a relatively affluent setting. So 10% of children in poverty, about 25% on average in Scotland. If you then go to the other side of the city, you look at around almost half of children in that neighbourhood are living in poverty, again against the national average of around 25%. And all the indicators are stacked against the children in this area. So all you need to do, without, and we're talking about things of lone parent households, overcrowded households, children with communication delay, this is before COVID, educational achievement, leavers with positive destinations, preschool children with likely developmental difficulties, babies exposed to passive smoking, the whole range of social and educational issues. And just look at how these shift when you go from one graph to the other. Right, the affluent area, the wind's blowing in the right direction, everything's in your favour. You're born in the East End, bang, that's where it hits you, doesn't it? And you don't see much green, and you see lots of waste ground. You see lots of toxic ground that's unusable. You see the economic value of land being very, very cheap compared to being some of the most expensive in the country, in the West End. So these are massive social and economic issues that education, the justice system, housing, etc., cannot tackle alone. We need a joined up, coherent approach in order to bring about change, to try and shift those indicators and bring them together. So, as Bob said earlier, that everybody can achieve their full potential, irrespective of where they come from. And as Bob said, it would be wrong to say that you can't grow up in the East End and end up at university president. Of course you can. But the point is, the odds are stacked against you. And what we can do in terms of bringing together different professional expertise, the weight of the academic community and the policy community, is try and just shift those odds a bit so you level the playing field. And that's really what we're about in terms of creating more equitable education systems and ultimately societies. So they're the diversity of the partners. This is where we sort of started in the East End. And you'll see, yes, the council's a big player, but you've also got private resources, Greggs, fast food, law, accountancy, Virgin money for everything from banks to spacecraft and holidays and elsewhere in between, third sector regeneration organisations and so forth. Individually, they're all trying really hard. They're all doing a really good job in their own way. But the point is, are they acting in isolation, not quite sure where they're going, all pulling in different directions? Are they all really focused as a set of organisations, but just happen to be pulling in different directions because they've got different priorities, which, in a sense, has individual impact on equalising these outcomes? But even if they were all pulling in the same direction, in a sort of coordinated way with the same set of priorities, are they doing it in their silos without talking to each other, protecting their own turf, ensuring that they get their funding from the next round from Scottish Government if they're in the third sector, trying to protect their budgets if they're the local authority? Or are they actually working together collectively so they're mutually reinforcing, pushing each other forward and ultimately having a greater impact than they would have individually? So the totality is greater than the sum of the parts. So that's sort of the idea, and it comes from Hennig and colleagues at Columbia, in terms of moving from a state of disorder and confusion. I don't think in general we're there as a system. We're probably somewhere between individual and coordinated as a whole, but the idea would be if we could only get everyone to pull together, we would shift those metrics that we saw earlier in a different way. And one way of practically doing that, probably say, is by thinking about this in terms of having a set of features, design features, if you will, I guess, in place. You can't do this on thin air. It needs resourcing, right? So you need to have a backbone support organisation, if they call it, some sort of coordinating function, a separate organisation to provide the administrative support, the logistical and coordination support, because you're bringing together lots of different players from lots of different perspectives, and it's complex. You need to have clear, consistent communication. Yeah, there's nothing more confusing when you're trying to bring people with a different set of professional identities, different set of values together, if that communication is confusing or absent. You need to develop mutually reinforcing agendas and activities, and they may not be there at the start, of course. So that's hard work. That's about, Marguerite was talking about relationships being key to this, and of course it's writ large in the literature and it's easy to say, but it's bloody damn difficult to do and bring it together in practice, as you guys will know when you try to do this when you're working with communities. Data is really important. And it took us, in a different project, 1.5 years, 18 months, to get 8 local authorities to put together a data sharing agreement. Yeah, so that's the enormity of the task facing us. Without data, we're doing things on instinct, on hunch. We're probably defaulting to our own professional views, biases, and so forth. So we need to have the data on the table, and that needs to be shared, and it needs to be open, and it needs to be transparent. And overall, you have to have a defining mission, a common agenda. There has to be something that all these different partners that you've managed to get around the table in the same room, wasn't that a miracle in the first place? You've got to have something that they can plant in the ground, that they can hoist their flag to and say, yes, this is what we believe in, this is what we're going to do. And they're all signed up to that. And underneath that, we have to be clear and have to be sure that each of us sitting around that table understand that sometimes it's not going to go our way. Sometimes we're going to be giving, we're going to be conceding, we're going to be handing over resource, we're going to be handing over power, we're going to be handing over control. But that's okay, because we all have the same set of values that pin us to that common agenda and that mission. And if you don't have that, this all falls apart. And I'll talk about leadership a bit in a minute. So that's the sort of the bigger picture. So I'm just trying to go a bit wide. Oh, no, I've turned it off. Very good. Yeah, we had a really complicated theory of change in children's neighbourhoods. Oh, let's not go there today. Hey, I know the Singaporeans. I know you like that sort of stuff. But children's neighbourhoods as an activity, as a programme, had 2 features. Okay, it had a developmental arm, and it had a research and evaluation arm. Right, and there were 3 parts really of that developmental arm. It was about promoting agency and empowering children and giving them a voice within their communities and within their neighbourhoods. It was about using that collective impact approach to try and get those synergies, so things were mutually reinforcing. And then thirdly, it was about trying to utilise and build on the assets that exist within the community and increase the participation and the capacity for decision making within communities to have a say in the services that were supposedly built around them to support them. So in effect, the community, the neighbourhood, moved from a position of having things being done to them to actually being involved and co-constructing the idea. And as part of that was breaking down the silos between these different providers, if you want to use that term.
Was CNS the backbone organisation?
CNS was the backbone organisation, yeah. So and I can talk about the structure a bit later, but there was an administrative part, a research part, and then a developmental part. So in terms of organisation, three components. And that's important, and it's important that the backbone organisation, I think, was located in the university, because it goes back to what Des was saying, because the university really doesn't have any skin in the game. We say there's no baggage there, and we can create a safe space much more easily where you can have open and transparent conversations than you can if you're doing it in, I don't know whether you've been to City Chambers, Glasgow City Council, on George Square, which is symbolic in terms of the power, control, and the hierarchy. It doesn't feel quite the same. So the second strand was around external research to inform our decision making. This means that we undertook a very detailed analysis of the context of the actual neighbourhood, and then based the developments and the ideas that came out of that on what the data was suggesting was where the strengths are, but also where the gaps were. Then testing that out through participatory research with children and young people and the wider community. The final strand really was about monitoring and evaluating the impact of CNS. So it's, in a sense, you could argue it's sort of design-based intervention research. So we've got cycles going where the research dimension is informing the developmental activity. This is what it's looked like since 2016. And a huge amount, does this have a light? Perhaps not. A huge amount of effort and time was put in by people in this room, actually, and many others, before we even launched this program, to build those relationships and get those stakeholders on side. So that earlier slide with all the different partners, they were the people that we got around the table. And there was a lot of skepticism. The head of Client Gateway, the regeneration, we've seen all this before. The university comes along with their shiny new idea, makes all these promises to the community about how it's all going to be wonderful, and then within a year they're gone. Yeah. So there was a lot of management of perception that was needed, and a lot of hard work to build those relationships and that trust. We worked with one site in that sort of dual way, as I said, really up until late 2017, when the Scottish Government came along with some resource, probably too much resource, actually, too soon. He says, about just under 5 million Singaporean dollars. And what they wanted us to do was to expand what was happening in one site to 6 other sites nationally. So, we argued it should be in the west of Scotland, A, because of resources, because Bob spoke about the landmass. There are issues, but you take a lot of resource in there. So and there's a lot of, and the concentration of poverty arguably is in the west of Scotland. And we got all those sites into operation, and then you can spot what the big red line, the big red fracture is. 19th of March 2020, 2 days before my birthday, when my Sunday birthday lunch was cancelled because the restaurant shut down. Of course, we went into lockdown, which threw everything up in the air, quite understandably. Because what you've got is a participatory program of work that is underpinned by the fact that you build relationships and you work face to face, very closely within 2 meters, often inside. It ain't happening, is it? So we flexed and switched our work very quickly to really produce a series of rapid reviews and insights to inform policy. Okay, so and around about that time, I was then asked to sit on sort of one of the scientific groups for children and young people and education to make decisions about various things regarding COVID, of course. And what we were able to do is actually get people in the field to do reviews around things like hub schools, so schools turning into community centres, to ways in which we could access hard to reach families and communities, how the lockdown and COVID was affecting immigrant families and refugees and so forth. So a whole different programme of work. We still kept working with our communities. So we had people out running outside mother and baby Friday morning coffee meetings in Clydebank down the road. You know, and again, as a way of sort of monitoring the situation, trying to get an indication of how people's health and well-being was, what they were thinking, how they were responding. So there was a really fast feedback loop into policy and decision-making circles, which I think has been underestimated in terms of its importance, actually, at the time, because nobody really knew what was going on, and it was very, very uncertain. And what was happening, from my perspective, in Scotland in particular, is particularly during those early phases of lockdown, the medics and the public health voices were disproportionately strong in terms of decision making. With hindsight, it's easy to say that because we didn't actually know really. And the other professionals that were sort of around the table in these decision making bodies' voices were less strong. So the attention during the early days that was given to the importance of the wider harms associated with COVID didn't really get the prominence that it should have done at the time. Now I think there's more of a balance, but that set the tone for the first certainly year, maybe a bit longer. That the decision making was really made on clinical issues around disease and prevalence and cases, and not breaking hospital capacity was the one defining agenda. Whereas actually now we're seeing, you know, the multitude of impact and diverse range of impacts of the pandemic. And you know, I would argue that Children's Neighbourhood was there at the forefront, you know, making that case and providing some early evidence for that. We use the capabilities approach, which is really important. This is all on the website, right? So you can, if you click on resources and go through it, you can see it all. And we use that really as a framework to get children to explore and think about and talk about what's important to them in terms of the domains of being safe, healthy, life expectancy, and so forth. There we go. There's the slide. We also did work exploring sort of service barriers, enablers to family support and different levels and different factors. We looked at critical incidents. So that when you take a case, you can see when you go through their experience of the system, whether it be healthcare or whatever, you can see the number of missed opportunities when somebody could have intervened and it would have taken the whole situation a totally different situation. And you would have averted the fact that a single mother has to go to a neighbour to borrow £20 in order to pay for a taxi to get them to go to the hospital the other side of town, because they've had a telephone consultation about the health of their child, and the telephone consultation said you need to go to hospital now. She borrows the £20, gets there, the child's fine, but then she can't afford to pay the rent next week because she's got to pay that £20. You know, so these really small little micro things have major impacts on people's lives. We expanded to 6 sites. We're really interested in how parts of what we're doing transfer to rural or town settings, and how parts didn't. If you're interested in the detail of the programme, you can see that. What was really important for us, and most of them came from third sector organisations, is that each site had a local coordinator who was really the glue that held the developmental work together, who managed the relationships, who worked across those different partnerships, those different boundaries, and made stuff happen, because neighbourhoods need to see stuff happening, just as funders do and everyone else, in order to gain confidence in the approach. And where our local coordinators were outstanding, tended to be where the programme had the most impact. So drawing out the lessons, the programme as a formal children's neighbourhood programme finished in 2022, although, as I'll explain, there's a legacy and new projects that have grown out of it. Context is everything, easy to say again, but having a really, from sort of an academic perspective, a really sort of deep understanding of the sort of the political, social and cultural barriers that exist in the neighbourhood, in the locality, and at national level are really, really important. So, for example, I think I think COVID is a major thing that happened in the middle of this, of course. But the very strength of children's neighbourhoods was also the very weakness. Right. So in government, we have directorates, probably just like you do, actually, and we didn't really belong to any one directorate because we were an interdisciplinary, multi-agency approach. We were funded from one directorate, but then every other directorate thought they had a bit of us. Mm-hmm. And they internally in government, they're looking at their budgets and where things are coming from. So trying to manage that relationship with central government is really tricky. And then you add in, as you have, a turnover of civil servants in different positions quite regularly. It's really hard to maintain that, or it's especially hard because of the nature of the programme to maintain that presence and that senior sponsorship in government, for example. So I just highlight that as an example. The whole premise of this is around building a network learning system. So moving the knowledge and expertise across boundaries, and valuing, as I said before, different forms of knowledge and expertise, and so you have parity. So it's not the university coming with its superior academic knowledge. Okay, we're just there as learning partners with you. And you have different things to bring to it. Yeah, we can bring in different networks and different types of knowledge, but yeah. And then finally the point about leadership and coordination. This type of approach cannot work if you are reliant on the leadership of what I call the leadership of the past, the leadership of power and position, of hierarchy, working within a bureaucracy. You have to have leadership of what I think will be the future, and that's leaders who, in the literature, they talk about reticulists as a phrase. These are leaders that can adapt their language. They're flexible. They're really acute networkers. These are the people that can work the room. They're very socially astute. They're risk takers, but they're not blind risk takers. They work within a framework, so they're trusted because they're not going to do something that's crazy. But they're not just going to do the norm and conform to the orthodoxy either. So developing and building the right kind of leaders to support this type of work is crucial. I don't think we're there yet in the UK, not just Scotland, in terms of the way that we think about leadership development, for example. Oh, my word. So that's drawing out lessons. The legacy, the future. Go on, do you want to take a photo?
No, it's all right.
Okay.
We'll supply them.
We'll supply them. So we've taken a number of the dimensions of children's neighbourhoods and used it in different settings on different projects. Some funded by the ESRC, others from other sources. We had a programme of work around climate change where we had children and young people working in their communities in Chile and in Scotland with teachers and academics undertaking their own research projects, who then took that to COP26 and to a panel with the leader from the local authority, the head of education from the local authority, and the co-leader of the Green Party, and the Minister for Green Economy and Green Skills, I think, something similar, to present their findings of their research and be quite tenacious in their questioning. And I know, certainly at the local authority level, there were follow-up meetings with the children and young people who presented, and changes were made. So that was really about acting locally and thinking globally. We have another project at Queen's University Belfast, which builds on the Chilean work, looking at the markets, which is an area in Belfast. Des and I are involved in the local place and innovation partnerships, and we're part of a hub, which is a group of 10 universities that work on that. We're developing a global research practice partnership network focusing on these issues. Hopefully includes Dennis here, hopefully including Singapore is one of our partners. And finally, Every Dundee Learner Matters, which is a citywide strategy for education at the moment. We're looking to press out and make that become more integrated and take a broader interdisciplinary approach. It is place-based in one sense, in fact that it's a citywide, but actually we're really education focused at the moment. We'd like to broaden that out. So I'll stop there. It's a bit of a whistle-stop tour, but hopefully it gives you an insight, and you've heard sort of 3 different perspectives this afternoon around sort of place, education, community, and perhaps how we can just begin to think a little bit differently about these issues compared to how we have done in the past.